Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today, we have a phenomenal conversation with Theresa Meadows. She is the CIO for Cook Children's Healthcare System out of Fort Worth, Texas, not to be confused with Chicago, Illinois. And we talk about a lot of different things. We talk about remote work. We talk about priorities for 2021 and beyond. We talk about what a children's integrated delivery network looks like. Again, I learned a ton of stuff in this conversation. I think you're going to really enjoy it. You know, somebody sent me a note and said, hey, how can we help out the podcast? There's two great ways you can help out the podcast. One is just shoot a note to a friend and tell them that you're getting a lot of benefit out of the show and that they should really subscribe to it. But another way you can really help us out is by, whatever app you're listening to the podcast on, go ahead and click and give us a review. Tell people about the value that you're getting from the show. We would really appreciate it. It helps us. It moves us up in the rankings in Apple and in Google and in the other services as well. And doesn't take that long, and we really appreciate it. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor. The first step is to send an email to partner@thisweekinhealthit.com. Now, on to today's show. All right, today we are joined by CIO for Cook Children's Healthcare System, Theresa Meadows, RN. Good morning, Theresa. Welcome to the show.
Hey, good morning. I'm really excited to be here. This is a great opportunity.
Yeah, I'm looking forward to this. And so you're working out of the office. I want people to know that it's your work office in case they're watching the video and they see all those, all the disheveled books and stuff behind you.
Yeah, the mess is definitely how my work environment looks on a regular basis.
Well, I remember when I became CIO for the health system, and the gentleman who was before me goes, okay, everything's on this shelf. And there was binders that were the thickest things you've ever seen. I'm like, do I have to read that? He goes, well, that's the EHR rollout plan. And this, I'm like, oh my gosh. And that's what you have. You have really thick binders behind you, probably different work plans and stuff.
That's funny because I think when I started here in 2010. I think those binders actually are from prior to me starting here. So you've pointed out that I probably need to do some spring cleaning.
Well, yeah, that's what happened to me after a while. I'm like, okay, I haven't opened those yet, and it's 5 years later. I should probably move them somewhere. That's I think I can't recall the last time I touched anything on that bottom shelf. So that's probably a good. That'll be on my to-do list of things to do, maybe in 2021. Well, I'm glad we had this conversation. Next time you're on the show, we'll be able to see if you've made any progress. Sorry about that.
I'll just point the camera in a different direction.
Yeah, exactly. So your first time guest, it's not the first time we've talked. We did a webinar together. I hosted a webinar on cost reduction strategies. You did that in the fall last year. It was it was good conversation, but since this is the first time on the show, tell us about Cook Children's a little bit.
Sure. Cook Children's is a pediatric integrated delivery system, and our primary location is right in the heart of Fort Worth. Every time I present, people say, oh, you're in Chicago. I'm like, yeah, real South Chicago. Like this accent is not I don't think this is a Chicago accent, but right in Fort Worth. The cool thing about Cook Children's is, and that a lot of people don't know, is we're actually made up of 9 different companies. And so when people hear about Cook Children's, they think primarily of our medical center, which is right in the heart of Fort Worth, 400 plus beds, 100, room, private room, NICU. So pretty typical pediatric hospital that you would think about. But we also have a physician network where we employ, 450, probably close to 500 physicians today. It continues to grow. We continue to acquire and bring physicians into our physician network. That physician network has locations throughout the state of Texas. We're probably at about 90 locations, providing primary care, specialty care, and urgent care throughout the state of Texas. So even as far as, west as San Angelo, and our coverage area, if you looked at it on a map, is about the same size as the state of New Mexico Of course, Texas is huge. So if you looked at where we were covering, you would see that from our physician practices, and we continue to acquire. We have a home health business where we see kids directly in their homes, and we do durable medical equipment, infusion therapies, and skilled nursing to kiddos' homes. And we also are a Medicaid health plan. So we administer Medicaid and CHIP and STAR for the state of Texas for about 150,000 members, give or take. So a couple of joint ventures that we have, and then of course our health system and our foundation. So very diverse set of activities, but also a lot of diverse technology, which makes this role really exciting because there's a lot of variety and a lot of challenges and opportunities there.
Pediatric IDN. So do you have like retail locations that are just for children out in the community? That's what it sounds like to me.
Yeah, we do. And so we don't, the other thing is we're not affiliated with any medical school. So a lot of pediatric facilities have some medical school or academic medical center affiliation, and we're total standalone. So if you looked at our global business, we're almost a $2 billion business overall, just with all of our different things that we do.
Wow. Gosh, I have a lot of different directions I want to go with you. That's fascinating to me, by the way. A pediatric IDN is, I don't want to show my ignorance here, but that's a first for me. I mean, I've talked to a lot of children's hospitals and those kind of things, but this concept of IDN, a lot of them build out their networks with partnerships throughout the community, but to have that many physicians on staff, to have that kind of remote capabilities, I mean, is that pretty common, or is that distinct? Do you know?
No, I don't think that's common. And we've been doing this as long as I've been here, so well before I even got here. And so we were a very early adopter, and I do think we're unique. I mean, I think we're one of the unique pediatric entities. We participate in Children's Hospital Association, so I have visibility into what other children's facilities look like, and there's maybe a handful that kind of look like us, but for the most part, they're affiliated with bigger institutions if they look more like us.
Well, talk about look like us. So you have the RN title. How many CIO RNs do we have out there?
It's very few. I think that may be growing. I know of about 5.
So tell us about your role. How did you end up as a CIO going that track?
Yeah, it's really interesting because if I thought about what I was going to be when I grow up, this would not have been where I would have even remotely placed myself. So I started my career in interventional cardiology transplant as a nurse. That was really where my passion was. I always wanted to be in healthcare. My best friend when I grew up, her dad was a nurse anesthetist. And so I originally thought that's what I wanted to do, is I wanted to, be a nurse anesthetist. I went to nursing school and I had one visit to the OR and decided that's not for me. And so I ended up, doing, intensive care nursing and, floor nursing, which, is where my passion started. And it's funny, I worked at a really large teaching institution, and in 1995, that institution decided they were going to implement physician order entry. And the way they chose to do it is they said, we're going to take nurses from each area, 35 nurses, and they are going to be the physician trainers. They're going to do the building. We're going to train them on how to build systems, and they're going to be that support for those physicians. And at that time, we had a dumb terminal, on the nurses station. We didn't really have computers. And my nurse manager said, "Hey, Theresa, you're pretty good with physicians. Would you like to do this? It's a 2-year project. You'll do this for a couple of years, and then you'll go back to your nursing job." And at that time, all I heard was no weekends, no nights, no holidays. I'm like, sure, sign me up. So it's sometimes in life, if you just sometimes do things that you don't really 100% know what it is. And what I learned through that was, first of all, IT projects are never over. They really are living, breathing entities that last forever. And I realized that I liked it, and I saw the value in taking technology and improving outcomes and improving clinical care. So from that point, I decided I would get a master's in informatics. I worked at Ernst & Young in consulting. I worked at WebMD in the .com era, worked at McKesson for a while, but my true heart is really and passion is in the acute care space. And so that's kind of how I circled back. I was at Ascension prior to here. And then, this opportunity came up and I'm like, I've always wanted to do that. And so I
Theresa, as you tell that story, I think of two things. One is you have to be about 80 years old with that number of careers. And then
I feel like it.
the second thing is no nights, no weekends. And has that played out exactly how you thought that was going to play out?
It had not, especially the first go live back, when we were implementing TDS. For any of you old timers who knew what TDS was, the first shift was a night shift. And I'm like, what the heck? How did this happen? How did this happen? I was supposed to no weekends, no nights, no holidays, right? So, but it's all worth it. It's definitely all worth it.
That's fantastic. So I want to hit a bunch of different topics. I want to talk remote work, priorities coming into 2021, price transparency, just a bunch of different things. Let's start with remote work because culture, productivity. These have been interesting topics coming into this year. We just came out of the JP Morgan conference, and I didn't hear any CEO even intimate that we were going to go back to the way we were before, where everybody works out of the office and whatnot. I think everyone's saying, okay, that has changed. We haven't determined what next is, but what I really want to do before we go to what's next is, the team is now, a percentage of which is remote. How have you done with regard to productivity? Let's start there. Well, first of all, what have you done? And then how have you have you been productive? How has that gone so far?
Yeah, it's interesting because we already had a semi-remote culture prior, at least in IT, prior to the pandemic. We had people who worked from home 1 day a week-ish. So it wasn't extreme. So we went from 1 day a week to everybody at home 5 days a week. So I think initially we struggled a little bit with productivity just because people were getting used to, well, how do I manage remote workers? How do I know things are getting done? And, we don't really have a detailed productivity measurement system. The way we measure productivity is we have 140 IT projects plus about 20 pandemic related projects. And the way we measure productivity is really based on delivery and customer satisfaction. And so our delivery has not slowed down. We continue to deliver, solutions. We've had, even through the pandemic, we took our health plan live on Epic Tapestry, doing fully remote support. So we've been so our measurement right now has been, okay, are we still delivering at the same rate and the level that the expectation was prior?
Yeah. So how have you had to change your personal communication style and management style as we have moved through the pandemic?
Yeah, it's interesting. I hate video. Probably because I don't like seeing myself on video mostly, but we do a lot more video. I have kind of instituted in our organization, our IT organization, you have to be on video. This hiding behind your beautiful picture that you have for your Zoom client. We need that social interaction. So one is we pretty much require that people be on video for a couple reasons. One, to keep that social interaction, but two, just you can tell how people are doing. And that's a huge concern of mine, that people's well-being is being watched. I write a lot more communications than I used to because I was used to getting a group together and us just talking about it. But now with everybody having schedules so packed with video conferences and those types of things, a lot more written communication, which proves to be difficult sometimes because you're like, I sent out this communication, nobody read it. So I think people are getting overwhelmed there. We've done like 2-minute video messages that we send out. via email so people can refer back and look at those 2-minute video messages. Just a lot of different techniques. I think we're still, working through what the best thing is.
Yeah, the management by walking around, that's how I was taught early on in my career. And so when I became a CIO, I get it. I get in pretty early. So I'd get in around 6 o'clock. I'd get a bunch of stuff done before 8:30 or so. And about 9 o'clock, I just started walking around. A lot of teams were doing their huddles and whatnot. I got to listen in on a bunch of huddles, and then I would just pop into people's offices and talk to them and that kind of stuff. I'm not sure what I would be doing today as a CIO. How do people pop in and talk to you? How do they, initiate that that conversation of, I have an idea?
Yeah, so we actually do that a couple ways. Through Skype. A lot of times you'll see the Skype window pop up and people will say, hey, I've got this thing going on, or I have this idea. So we've been using Skype. We've also been using Teams. We're in a transition. We haven't gotten to 365 yet. So we're in that in-between stage where we're making a transition to Office 365. So we've been using some of the Teams functionality to, do that pop-in type of mentality. But I agree with you. That's the one thing I miss the most, because I was a walk-around leader too. And now I walk around and I look at empty cubicles that are still have Easter decorations from March.
Well, they'll be appropriate in a month or so.
So by the time we get back to what we're doing, we're all decorated for Easter. But yeah, so that it's been a struggle for me, and it's been a struggle for our culture in general, because we're a walk around collaborative in-person culture. So it's not just an IT issue at Cook Children's. It's a global issue that we're all struggling with, because we are very collaborative and we'd like to see each other in person. And so it's been a challenge to work through.
Yeah. Have you guys started conversations? And I think this is going to be health system specific. I think it's going to be geography specific. Have you started to have the conversations of what post-COVID work looks like?
We have. And so we've gone through a process where we've actually taken our employees and we kind of categorize them. We actually have already determined 500 plus employees who will just stay at home permanently. And now we're working through what we're considering hybrid workers, which that definition is sometimes in the office, sometimes at home. And then we have of course, the people who are at work 100% of the time. And so it's that hybrid part in the middle that's the hard part. Because so we've kind of said, okay, if you're less than 50% at time at home, then we're going to provide you an office and a parking space and, all the things you need on campus. But if you're greater than 50% at home, then we're going to assume your home office, your primary office is your home. And now we're looking at space reallocation and what do we do to reallocate space and parking and those types of things. The unfortunate part for us is we don't lease space very often. So we own all of our physical space. So we could clear it out, but we don't know what we'll do with it. So we haven't been super speedy at trying to get people to get moved out to their homes, because, we've got the space and we can use it. I think it's really, how do we use it in the future?
Yeah. What's your fiscal year at Cook Children's?
It's October 1st.
The reason I ask that is I'm going to ask what the technology priorities for 2021 are. And sometimes some people look at me like, hey, we have a June fiscal year, in which case they're already halfway through. And
yeah, we're in our second quarter. Yeah, second quarter of 21.
So, I mean, when you were planning this, we were mid-pandemic. So what are the technology priorities for 21? What do they look like?
Yeah, mobile and digital for sure. I think that we had that as a priority prior to the pandemic, but we've escalated that priority because of the amount of remote work, and because even through a pandemic, we're building another hospital in North Dallas, in an area where the expectation from our consumers is, I want to do it on my phone and I want to do it as rapidly and as quickly as possible. So we really have two paths: one to enable our patients to be more mobile, and the second is for our employees. How do we enable them to be more mobile and be more agile in their work? The second priority is really around data. And, data has proven hard through COVID, and sharing the data specifically around vaccines and, testing and those types of things. So we've learned a lot about how we want to structure our data plan going forward, because data is going to be and has been king. I think people just didn't realize it until we've kind of gone through this change in how we work each day. So we're asking a lot more questions and using a lot more data than we have, in the 10 years that I've been here, which is pretty interesting.
So just out of curiosity, do you rely on your EHR? Do you have like a third party thing like Health Catalyst or something to that effect? Or do you have your own homegrown type data solutions?
Yeah, we have a combination of homegrown and the Epic data repository type tools. And then we use third party visualization. So we have a data warehousing structure for all our data that's not in Epic, because we've only been live on Epic for 3 years. So we had a huge data infrastructure that was somewhat homegrown prior to going to Epic. So we kind of have a hybrid model where we use, products like Tableau or to bring those data elements together visually. And we have a pretty strong data integration team, which has been extremely helpful during COVID in this time period.
Well, that's that takes us to interoperability. And, children's hospitals are unique in that their interoperability strategy has to be really good, because, you're connecting with so many people and you're handing off your patients. Very few people have to plan for handing off your patients, but at some point they're not pediatric anymore and they move on. So what does an interoperability strategy look like for a children's hospital?
Yeah, it has a couple of legs. The interesting thing about the Dallas-Fort Worth area, almost everyone's on Epic. We were the last, pretty much Methodist, and then us, we were the last holdout. And so a big part of our strategy is care everywhere, just because of the amount of patients who move around between all the different entities in the Dallas-Fort Worth area. The second thing is we really, share data a lot with other children's hospitals. So our second strategy is, how do we connect at the most efficiently with other children's hospitals? Because we do share patients back and forth depending on, what specialties and what things we have. And so how do we connect to those, those other children's hospitals efficiently? And then the third leg is really around API development, because what we're seeing is that a lot of our families and kiddos are using technologies like apps to track their health. They're using things like Fitbit and Apple Watches and smart scales and all of these things. And so we have a strategy to use APIs to connect to those devices and really start to, have kids really be part of their care at home. So our strategy is really, how do we integrate to those kids at home through interoperability? And then we get tons of data requests through research. And so we have started sharing, data with research networks and those types of things. So it's a lot of different things, but our goal is to share as much as possible, because we think that is really important, not only for our organization, but for the ecosystem as a whole, to be able to do that.
Yeah, it's interesting. The digital strategies are increasing the number of touch points. So you're interacting a lot more with your patients, and it's increasing the data points, right? So we have this Internet of Health things out there now. How are you helping your physicians? I mean, obviously we start collecting all that information. I remember the pushback I got was the clinicians were like, I don't want it. And I'm like, all right, why don't you want it? And they're like, 2 reasons. And it was very clear. It's like 2 reasons I don't want it. One is it's a lot of information, and you're just messing up the record. There's just too much information for me to review. And the second is, if it's in the record, I become liable for it. So they were worried about liability, and they were worried about the amount of information. Are you doing something to address those 2 things?
Yeah, we are. And so it's interesting, because what's kind of changed, and I think it's because of the pandemic, our physicians now are wanting to get data from kids at home. They don't want them to come here. So there's kind of been a shift about, okay, we want that data, but we don't want everything to go into the record. So we have a process where they can actually accept the things they want and reject the things they don't.
Yeah.
which has proven very valuable because some physicians like a lot of data and other physicians like almost none. And so they have the ability. And then we have just some mandatory requirements where we say, look, these kind of things will come into the record because you need those from a liability perspective to make sure that you're protected and the patient's protected in the event there was something negative occur. And so we work closely with legal on this and with our health information management group on how do we define the medical record and what's included in the medical record versus what's great data for research that we're going to bring in, but we're going to exclude that if somebody requested the medical record, we'll exclude that, but we'll use it for research purposes and other things.
That's cool. So no, I can't remember asking a children's hospital about this, but what kind of regulatory things are you looking at? Are you looking at 21st century cures? Are you looking at price transparency? What regulatory things are on your plate?
We are. It's interesting. We went live with our shoppable services on January 1st. And so we actually, if you went to cookchildrens.org, you could get estimates on the 400 procedures that we're required to do. Also in our patient portal, My Cook Children's is what we call it, My Chart. You can actually do pricing estimates in My Chart today, where you actually can put in, I'm having this procedure, and we'll provide the pricing estimate. And we also have the machine readable files that we've produced. We felt that it was important that we start providing that information to our patients. Other facilities have decided that they'll just wait it out and see if they get fined and those types of things. But we decided we would go the more conservative route and just go ahead and bite the bullet there and start providing that information to patients, which I think it's the right thing to do. Is it easy to understand? Sorry, my lights just went out. That happens periodically when you don't move around.
Oh, yeah. I've had that in other interviews, by the way. I did in-person interviews and the lights went out on us.
Yeah, we have motion sense lights, so if you don't move quite a bit, it goes out. So we've been doing that since the 1st of January, which, I wish I don't have really a lot of data about how many people have used it, but we'll be looking at that to see how that's going. And the 21st Century Cures Act absolutely applies to us. So we were thankful for the little delay from November to April as far as providing, real-time access to your medical record and being very transparent with your data. Because in PEDS, there's a lot of sensitive data that we wanted to be able to go through more thoroughly and not just have to release everything automatically to families and patients, because some of that requires, education and discussion to those particular patients. And there's some unique issues there because each state, depending on their laws, some kids own their patient record at age 12 and 13.
Yeah.
And so what's the risk of, sending a negative result or something that's, could change the life of a kid to a 13-year-old just automatically. So we're actively working through the information blocking provisions and the API provisions to be able to, provide data to other applications if asked. Pretty much most of the things apply to us. If you looked back to meaningful use, that was a little bit different because of Medicaid, and that was really state dependent. So like in our state, we just had to say we implemented something and we received meaningful use dollars. It wasn't we weren't judged, we weren't reviewed on metrics, but that's going to change over time, I think, for PEDS.
Yeah, it's going to be interesting. The regulatory path, I'm going to be following the price transparency rule pretty closely. I think I'm going to ask every CIO who comes on the show about how they've implemented. One of the things I was talking to Rob DiMache about this, who's a former CFO for UPMC. We're just discussing that there's some problems with the rule. And one of the biggest problems with the rule is they didn't tell health systems where to put the data. And so we have to go find it. We go to their website, we have to find it. And some are like in complete compliance, but it's buried. You just have to, do a lot of search to find it.
Yeah, and I definitely see that in more competitive markets, right? the more competitive your market is, the deeper you have to go to find the information. We had a lot of discussions about that because it is about competition somewhat and about where we would do it. Right.
No, it's yeah. I mean, I would imagine those conversations were interesting. All right, let's hit two more technology topics, and then we'll close out. And any plans around AI, machine learning, RPA, anything like that?
Yeah, we're actually looking at all of those right now. We had an RPA project slotted to start right before COVID hit, so it kind of got delayed a little bit just because of the amount of work that it was going to take. But we're definitely looking at RPA in our finance and some of our supply chain areas because there's a lot of opportunity there.
Okay, can you share any specifics? Have you selected a vendor or heading in a direction?
We've narrowed it down. There's not a ton of vendors for RPA, so we're down to the final two. And if you thinking through my vault here of, I can't think of the top two names, but yes, we're narrowed it down to two. And our team, and we worked with a consulting firm to at least help us set up some RPA governance structure,
right?
Because everything's not RPA worthy. But people could think of 1,000 ideas that you could use RPA for. And then we're also looking at artificial intelligence for things like some of the chatbot functionality. That's proven very useful during COVID, where we're using some chatbot technology for frequently asked questions about, do I need to be tested? Mostly internally with employees, not with patients so much, because with COVID, the interesting thing in peds is we're dealing with adults because all of our employees are at risk for COVID. And then we're also dealing with our patients. So we had lots and lots of internal questions from employees about what to do. So we used some of that chatbot functionality to kind of help alleviate the phone calling.
Yeah. It'll be interesting to see what we do with chatbots moving forward because it's now been sort of introduced into our vernacular. I think
AI is just going to continue and machine learning. We were using some predictive modeling and different things in some of our research studies that we're doing. So I expect that just to grow over time.
I was talking with Lee Milligan, who's the CIO at Asante, about RPA, and one of the areas he said that they would love to have RPAs in testing around the EHR for EHR updates and those kind of things. He was talking about Beaker and how they have to test everything. He's like, man, if we could just pop RPA in there somehow to do the testing, he goes, because we have to test every single aspect of that, and it would be a great tool for that.
Yeah, there's a lot of IT use cases. So I was a huge proponent for it. If nobody used it but us, it would be a win, because there are a lot of repetitive things that we do in IT that RPA is perfect for. Password creation, password termination.
That whole user provisioning process could really use RPA.
Yeah, so there's a ton of use cases just in IT operations that I think where RPA could be extremely valuable.
Are you guys leveraging the cloud at all?
We have a mixed strategy around cloud. We use cloud where cloud makes sense. That's kind of our strategy. So we have a lot of third-party applications in the cloud. Our ERP we're in an ERP selection process right now, and it will go to the cloud regardless of the choice. So that will be moving in the near future. And of course, our Office 365 implementation will take us more. We have not taken any of our electronic medical record to the cloud. We were a previous cloud medical record when we were with Athena Health. So we've had that experience, and we have a lot of lessons learned there that if we do that again, we would not repeat.
Well, so I think it's going to be interesting with Epic, because I think this Irish move is part of the journey to really see Epic become a cloud provider.
I think so too. And I always joke, we've kind of all been cloud for a while. So we've had 95% 5% virtualization in our data center for 5+ years. So technically, we've had our own little cloud environment over there with how we've chosen to deploy applications and, our remote work activity. So it'll be interesting to see how it evolves. But I think we'll see more and more, especially with remote work.
So Theresa, I guess action items from this call are to clean out that bottom row of binders.
Absolutely. Yep. That's number one. Unfortunately, the top rows, I still like a physical book. I try to read books online, and I do that, but I love the physical book. So I don't know if I'll be able to get away from that.
We just moved into a house, and we gave a lot of our books before we moved to the local public library, but I found myself already amassing books. I'm the same as you. I like taking notes. I like the feel of it in my hands. I like taking it to the beach. I don't know how you. I don't know if that's just going to be a preference.
Another interesting thing that I've started doing, my husband does this a lot too, is I'll listen to the book and read it at the same time. And so sometimes, so I can make notes I do some similar things where I can listen to it and then also follow along. So it'll be interesting to see if I can get away from it, but I love a good piece of paper book.
Well, Theresa, thanks for doing this. I know we're on different time zones, so you did this pretty early, and I really appreciate it.
You're welcome. Thank you for having me on the show.
Yeah, we'll have to do it again.
Yes, we will.
What a great discussion. If you know of someone that might benefit from our channel from these kinds of discussions, please forward them a note. They can subscribe on our website, thisweekhealth.com, or you can go to wherever you listen to podcasts, Apple, Google, Overcast. That's what I use, Spotify, Stitcher. We're out there. You can find us. Go ahead and subscribe today, or send a note to someone and have them subscribe. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, and Starbridge Advisors. Thanks for listening. That's all for now.